Welcome, everybody. Thank you for joining us today. We're going to get started here. And as you can see, you have joined our FCAA CONNECT, examining intersections of LGBT youth, housing, and healthcare during COVID-19, a conversation for funders. So we're really excited for this really terrific conversation. We also wanted to thank our sponsors, Funders Together to End Homelessness and Funders for LGBTQ Issues. Just a quick reminder, I know at this point, probably no one needs a reminder of how Zoom works, but everybody will be on mute today, but you can still use the chat and the Q&A function if you want to share comments or reactions or questions with any of our panelists. We will pause at the end for a Q&A, and we really encourage you to be an active part of that discussion. If you do have questions or looking for other information, we have started to post some resources on the FCAA website, and we'll continue to do that as if things come up and stuff. So we encourage you to look there as well. As a reminder, this session will be recorded, so everything's live, and we'll share the recording after the fact. But just to go ahead and kick off the conversation, I'm going to turn over to our moderator and leader today, Amelia.
Thanks, Sarah. Hi, everybody. Welcome. So glad to have you here for this discussion. My name is Amelia Karangi, and I am with ViiV Healthcare. I help to lead our positive action community giving across the U.S. And I am super glad to share some space with folks across the country who are working at the intersection of LGBTQ youth, housing, and healthcare during this time when it is most important to focus on what's happening right now, what needs to be happening right now for young people who are experiencing homelessness across the US. And so we are coming together to shine a light at this intersection. And at ViiV, we're committed to young people living with and most vulnerable to HIV, and that includes LGBTQ young people who have experienced homelessness. And we know that every year there are millions of teens and young adults who experience homelessness in any given year, and that Black and brown young people and LGBTQ young people are among those most at risk of experiencing homelessness. And we're convening this group with funders concerned about AIDS and funders for LGBTQ issues and funders together to end homelessness, with the hope of shining some bright spots on ways that funders can invest and take action right now. So I'm thrilled to be with some of our grant partners here who are leading the charge, both in terms of systemic change to end youth homelessness, as well as system hacks that are working right now to make sure that those that are most vulnerable are getting their care. So we're gonna talk about the landscape. We're going to talk about the changes that are happening and what needs to stick around. And we're gonna hear some clear advice for how funders can best support right now. So with that, I'm gonna ask each of my fantastic colleagues to introduce themselves, where they're coming from, what they do in the work, so that folks on the line get a better sense of who you are. I see Gabe first, so we'll start with you, Gabe. Can you say hello?
Yes, thank you, Amelia, and thank you to the organizers of the conference. I'm really excited to be here. My name is Gabriel Maldonado. I am the founder and CEO of True Evolution. We are a community health and social justice organization based in Riverside, California. If anyone's unfamiliar, Riverside, California sits in the boot of Southern California and is nestled just in between San Diego and Orange County and Los Angeles County. And our organization serves both Riverside and San Bernardino County, and we offer myriad of HIV services, but also mental health and our now flagship housing program. And so I'm very excited to be here and talk a little bit more about youth and housing.
Thanks, Gabe. Welcome. Milan, do you want to introduce yourself?
Hello, everyone. My name is Milan Randolph. My main job is a senior research interviewer at Emory University in the Rollins School of Public Health. And I also chair the Georgia Prevention and Care Council as a prevention co-chair under the Georgia Department of Public Health. And I also have experienced homelessness, and I am a youth. So I have a lot of experience with understanding the landscape and the system of homelessness and housing, as well as living with HIV. I've been to several different service providers throughout the state of Georgia and throughout the city of Atlanta. And with the work that I do with the Department of Public Health, I've had the pleasure to meet several different providers, both on the prevention and care side of HIV, and the work that they do. So I bring a lot of perspectives from a lot of different people to uplift the voices of advocates and young people experiencing homelessness and people living with HIV.
So glad you're here, Milan. Welcome. Larry, do you want to say hello?
Sure. Hello. Thank you, Amelia, and thank you to the organizers and to Milan and Gabe. Really appreciate you. You're amazing. Look forward to today's webinar on Point Source Youth. I'm executive director and co-founder of, and we work nationally and locally to scale up new and meaningful solutions to put power in the hands of amazing young people and to end youth homelessness and operate at the intersections of HIV and youth homelessness. And I'm very excited to be here.
Thanks for having us. So Larry, we're gonna start with you and ask you to tell us a little bit about the landscape right now. What's happening? What are you seeing for LGBTQ youth who are experiencing homelessness? Paint a picture for us.
Yeah, sure. I mean, the picture is change and uncertain times. During the last shutdown, we saw a lot of drop-in centers and a lot of service providers in local communities kind of shut down due to health and safety concerns, and a lot of youth then lack access to care. And so we're also seeing a lot of innovation because during those times of disruptions, you kind of can't do business as usual. So great providers like Gabe innovate and figure out a way to get the job done, even in those difficult times. So we're seeing both changes, disruptions, and innovations. One example of innovations is with housing and cash, right? If youth can't get housing, if we can't get hotel rooms, can we give youth cash and case management to help them co-navigate and self-direct their own housing? So I think that's really an exciting time. And we're also seeing right now that there's going to be more of that. So I think we have a responsibility as
I think Larry is frozen, which means he may come back in just a moment. Milan, can you hear me?
Yes, I can.
Yes. Okay, great. Well, I'm gonna take this tech pivot and ask you, Milan, to tell us a little bit of what you're seeing. What's the landscape like right now from your perspective for young people, LGBTQ young people?
So the landscape as I see it has been and has always been pretty disjointed and not together. So again, the work that I do spans throughout the state of Georgia and often sometimes in other states in the South, but mostly in the state of Georgia. And it's been really difficult to access services now. That has been the big change, is that the way services are assessed by youth and young people or anyone requiring or needing services, again, as Larry stated, that because drop-in centers and community centers have closed, all of those things have really made it difficult to receive the services that are natural to life, like so taking showers, washing clothes, getting food. Like those regular services have been stopped to prevent the spread of COVID-19, but it doesn't prevent hunger, and it doesn't prevent STIs, and it doesn't prevent depression. It doesn't, you know what I'm saying? These things are actually now at the height of the focus of our human condition that we were all focused on before. But the determinants that put LGBTQ people and people of color into the situations that make us require housing and HIV services and healthcare services that are supplemented by the government in the first place because we can't afford them, all of those things now are the first to go. So the things that are at the front lines to assess it for young people, like HIV testing and STI testing, all of those things have been completely halted in a lot of places in Georgia and still haven't recovered yet. So I'm really bothered by things like that because people are still homeless. People are still in need of these services. People are still acquiring STIs. And in the past 5 years, STIs have only gotten worse. And every single year the STI rates have increased. So those are the things we need to consider, that the world didn't stop when COVID-19 started. and the landscape has already been in its own sense of discoordination, like not coordinating its services under one umbrella or one arm, but at least it was effective. It was adding some type of relief to our communities. But now that relief is starting to waver off, and our concerns are less about the people and more about just preventing the spread, but we have to do both.
Gabe, what are you seeing in California? What's the landscape looking like for LGBTQ young people who are precariously housed or at risk of being homeless? What's going on?
Well, I think that both Larry and Milan gave a more brilliant overview than I could do justice to really talk about some of the existing structural and social determinants that kind of were exacerbated and sort of put on steroids in the wake of COVID-19. You have to understand that California is, the largest, very large geographic territory, and we have a homeless population that is extremely transient. It is very common for people to go from Los Angeles County to Orange County, live with your grandma in San Diego, but there's affordable housing in Riverside, but then you get all of your medical services because the best services are in LA County. So you're hopping between multiple counties. That is a very common experience for a Southern California resident, very common for a California resident. And so access to transportation for those that did not always have vehicles kind of became a life or death situation because your vehicle now became your shelter, right? So for those that did not have vehicles, they were now reliant on having to be forced into congregated housing spaces by sleeping on people's couches, going to a shelter, staying at an SRO, sleeping with friends, 5 into a room. And so you see all of these sort of opposing kinds of issue priorities combat each other because in one regard, you have to be stably housed, but then there's a really necessary, concern to have social distancing. So that's what happened. What I want to add though, is because Milan and Larry did a great job to humanizing the end user. What I want to talk about is our institutional response. So as institutions during COVID-19 in our ability to respond to LGBTQ homeless youth, we found many of the protocols were not in place to handle this sort of social distancing environment, namely that HUD is still requiring that all of the paperwork we do still have in-person signatures. So what protocol is like that now when we're trying to protect our workforce? We didn't have the infrastructure that was needed under this particular environment. And for those of us that are in rural areas, some of our population don't have access to reliable broadband internet or even a device that allows for a user interface for telehealth. So there were certain infrastructures that we didn't have. And then also there's a whole new skill set that is needed. I can speak on behalf of a lot of community-based organizations. Telecommunications and IT isn't its own departmental structure. It's like a line item, right? It's not its own department. But now in the wake of COVID-19, we have to now essentially have IT departments as community-based organizations. And that is a whole new kind of skill set and infrastructure that we didn't have before, that we need.
There's so many pieces of technology that influence LGBTQ young people's lives right now. And you started to talk a little bit, Gabe, about the infrastructure related needs. Milan, can you talk a little bit about what's going on in terms of technology and access to care for young people that you're seeing?
I've actually seen, and this goes to one of the successes of the time, is that as it relates to general healthcare, like primary care, for those who have coverage, I have seen a higher uptake in retention in care and accessing care for things that can be done remotely or things that can be done via Zoom. So I really appreciate that. For those that were quick to respond in that way, we're able to not disrupt their services in the community in such a way where our lives were disrupted to where we couldn't still access or get questions answered about some minor health concerns, or whether it be mental health is actually. One thing that I talk to people about this all the time. I was actually doing mental health services over the phone before COVID-19, pre-COVID. And people would always tell me oh, well, I would just have to go to work and the time, and it's just so hard and difficult to make time. I'm like, just call my therapist. I just take an hour, I go into my office, and I talk to my therapist. Like, you can make the time. Like, it's actually much more accessible now because those services that I had to ask for is now more openly and readily available for free and is being offered as a regular service. So I do see more people taking advantage of mental health services as well as primary care services via telehealth. So I really do like that.
Amelia,
Larry,
oh, good. I was going to let you know Larry was here. Thank you.
Larry, I want to make sure we can hear you. Can we hear you?
Can you hear me now?
Yes, we can hear you now. We're talking a little bit about the shifts that have happened in the landscape for young people at this intersection, and wanted to see, you know, what are you noticing in terms of how organizations are adapting, and what are some of the changes that we need to lock in? What are some of the things we need to hold on to that are positive in this moment?
Yeah, I think that's a really great question. I mean, as folks mentioned, that doing telehealth and health via more flexible means is really critical. I mean, Mitch Stripling from Planned Parenthood Emergency Services is going to join our conference next week, and he talks a lot about, you know, we have to do whatever is necessary now given the challenges of the pandemic, and then secondly we have to lock those things in and those flexibilities in. So things like not requiring in-person SIGs on documents, doing Zoom meetings, not having too many HIPAA type security requirements, so folks can have flexible access. And so, for example, back to, you know, doing cash transfers, sending youth money via Venmo, doing case management via Instagram Messenger. So now is a time where we can ask youth, you know, what do you all need, and where do you need it, and how should we give it to you, and answer that question pretty simply. So if a young person needs money, let's send it by Venmo. If they have a question, and if they're on Instagram, let's answer it there. So I think this is a time to kind of document what youth need, show how we can deliver it in that new way, and then document the evidence that that thing works so that we can then get more money for it. So I think now is a very challenging time, as we can see by my internet going out due to my power going out, but also a really innovative time because now I'm doing this on my phone, and can be on Instagram Messenger if I needed a case manager. So we have to all be flexible.
Mm-hmm. Talk to us a little bit about cash transfers and what's happening there. Give us a sense of what that means and where that evidence is right now, what you're seeing.
Yeah, so globally, the best studied intervention to end poverty is direct cash transfers. You don't send grain to somebody to then redistribute to a local person. You give that person the cash that they need, and they make their own businesses and they navigate their own lives. So cash transfers is the best globally studied intervention. Then Point Source Youth is working with Chapin Hall at the University of Chicago to then launch and document the evidence supporting cash transfers as a solution to end youth homelessness. We just finished focus groups in New York City with young people, and have since collectively raised over $1 million to start that first program in New York City. And that is then going to scale out to California. So looking at you, Gabe, and many other cities. And so what that looks like is a young person shows up, they need supports and they need housing. So instead of going on a waiting list, instead of having to find a building, they then get Venmo'd money. So the money matches the cost of housing in a given area. So something like $1,200 a month on a frequent basis, like every week, for a long period of time, like 2 years. And then that youth that gets optional services that they may find helpful, like case managed, like I just had a call with a funder who hated the word case managed. Nobody has a case that needs to be managed. So I just kind of self-corrected there. So they can have a peer navigator supporting them via Instagram Messenger on what that young person says that they need to help use that cash in a way that is most helpful to them. And at our conference next week, at the Point Source Youth 4th Annual Symposium on Solutions to End Youth Homelessness, the first randomized controlled trial will be presented there in Canada, where they gave folks experiencing homelessness $7,500 Canadian dollars, and they used it super wisely, and they had really great housing outcomes. So a lot of our myths about, what we think is going to happen when we give thousands of dollars to folks are not based in reality. And in fact, when we force folks to stay on waiting lists, when we remove folks from housing based on rules, that's when we have bad things happen, not when we give youth money. So I'm really excited about that.
Thanks for lifting up that solution right now. I think we need to shine a light on everywhere that there is evidence pointing to something for change for young people right now. So I appreciate the work that Point Source Youth is doing to document that and expand and scale that intervention for young people. Gabe, what are you seeing as things that have shifted for the better that need to be kept around?
Yeah, I mean, exactly what both Larry and Milan said. Milan made reference to it around mental health, and Larry's making reference to it around cash transfers, is that there's a lot of innovation that's being permitted right now. And when I say innovation, it's not just in the ideas that are being generated, but it's also been in how policies are accepting it. So, as a provider, I am not just charged with developing an innovation that's best for community. If that was my job, I would love it, but that is not my only job. My job is to also cater to a whole host of funders and government regulations that often inhibit and prohibit innovation. And so the first thing I would say is policies around mental health billing. If we're going to be sustainable with providing mental health services, we need to fight hard to ensure that all of the allowances and waivers that have been given to telehealth are maintained, and that the rates that we're paying for telehealth are maintained. I think cash transfers is another major investment that we really need to be looking at, because there's sometimes some backwards regulatory policy around housing vouchers. I think the one thing that throws me off the most is, let's say a young person receives a $900 voucher, right? And this is the state of California. So any of you who live here know that there is no rural area anywhere, okay, where $900 can get you, real adequate affordable living in the state of California. But let's say a young person was able to get a $500 cash transfer every month, and they were able to take that 500 and that 900 and be able to afford a more adequate cost of living, right? Right now, there's many vouchers that prohibit and restrict the utilization of supplemental funds to increase your, the market value rent that you're going to go after. There's restrictions on that. We tell people you have to be poor and stay poor and live poor, and your environment should look poor. And I think that things like cash transfers are an innovative tool to overcome some of those stigmatizing barriers around housing. And then lastly, I would say is the investment in the nonprofit infrastructure. Right now, it has been so hard over the last 13 years in this county to make the case to funders that infectious and disease prevention services should be invested in. We're not always cool, right? We're a traditional public health organization, and that's not always sexy to a lot of funders who are looking for sexy projects. Let's just be frank. They look for sexy projects often. It's not often just about the impact. It's often about what looks the nicest. And I think now what this time has shown is that the traditional public health tools and disease prevention and the basic, like Milan mentioned, the most fundamental human services are now at the precipice of importance for us. Like, it is most important for us to be looking at this in the future and in 2021. And I'm really excited by this kind of, attention that the public health sector has gotten. And I think we need to keep that momentum going about the basic universal standards around public health, sanitation, and access to human services.
It sounds like it feels like a moment to seize and build on in some ways. What's on some of your advice for funders right now? How to seize this moment? What do you want to see? Where are there little golden nuggets, if anywhere, that you wish funders would glob onto?
Yeah, so I just made a list of just 4 points. The first one is rural health. So I am a co-founder along with Tony Young from the Community Education Group of the Rural Health Service Provider Network. And we represent a very subsector of rural health providers that are often left out of federal funding and state funding often. And so really looking at an investment in rural health is something that private funders in particular could do that is not being met by the government. Second one is telehealth. Although I agree with Larry that I wish that my staff could do peer navigation on Instagram, that is currently not billable by the Center for Medicaid Services.
We're gonna work on it.
Okay, all right, please do, because my team would love that, but there is actual very expensive infrastructure. It's actually very costly, particularly for those of us in rural areas, to do telehealth. There's a lot of HIPAA requirements, and particularly around billing. So telehealth is an investment. The other one is local policy and advocacy. And so right now, a lot of us don't have a lot of faith in where the federal government's going to go, and we can't put all of our eggs in that basket. So right now, my organization has been doing a lot of advocacy work at the state and local level on repurposing existing funding and looking at how we can reimagine and reuse existing funding streams. And then lastly is the nonprofit infrastructure. People forget we are a business. I am subjected to all the business requirements that any company is, other than income business tax. Other than that, everything else is fair game. And so if you want community-based organizations to survive in these times, there needs to be more general operating support and unrestricted giving in the same concept that Larry has with cash incentives for the end user and the consumers determining their own destiny. If you're going to believe in that principle, then you also have to believe in the principle of general operating support, because you need to allow us as the community that's serving the people that we're trying to give cash transfers to be able to determine our own destinies. And so there needs to be a greater investment in the nonprofit infrastructure, mostly with capital funding, general operating support, and unrestricted program grants. So those we need more of if you want us to do stuff that's this innovative. Those are my four.
I love hearing Gabe. Gabe is the best. So my list of things would be echo a lot of just what Gabe said. Here personally, one example that I have that I got Emory to follow up on is AIDS Walk. So AIDS Walk is well, at least here in Atlanta, AHF is now putting on AIDS Walk instead of Aid Atlanta, and they're matching funds for all the organizations that are one of the participating organizations of the walk. So any money that you put into that is automatically doubled by AHF. So looking for opportunities for funds to be matched are also opportunities to better or to increase your impact on organizations. So, and also to get involved in what those community organizations are having going on. So as Gabe was talking about with advocacy and whatnot, I've often been involved with different advocacy on so many different levels, whether it be locally, state, or federal, and none of them happen overnight. That's one thing. So it's like the fight is everlasting, it's ongoing, and it takes some patience. But I did some advocacy work for ADAP pharmacies. We have ADAP pharmacies in Atlanta where, just as Gabe was saying, is that you may go to your doctor's appointment at a community-based organization that has a in-house pharmacy, but you can't get your meds from that pharmacy. So now you have to go across town or on the other side of town just to get your medication. So the point of having a pharmacy in-house was to improve the quality of care and services that you offer at your institution, but you can't provide the main service that your clients need. After that advocacy that we discussed 3 years ago, we just found out that 4 different pharmacies in Atlanta have just been added as ADAP pharmacies. So it takes time, but the people who will benefit from that today and ongoing will never have even known that this was a problem that they had to face, and it's adding to the betterment of our service and our quality that we provide for people. So I feel like advocating for what the community is advocating for will often give better outcomes to what we're actually putting out. Because I think the issue that I have with funders, and I've sat and worked with a lot of different nonprofits, where I've listened to nonprofits lie. And I'm gonna be that guy today. I've listened to them lie about outcomes and things that they said that their grants or the money that they used and what they did and the outcomes that have happened. I feel like we should be holding them more accountable to that. Ask for actual testimonials from clients and people who service it, unsolicited by the individual agency that provided that service. Because again, you don't want to taint that outcome, but to see if your actual funds are actually making a difference in the community. So just as Gabe was saying again, is that looking for sexy projects that help 5 people instead of looking for an effective project that helps bring 50 people out of poverty, that is the goal. So to educate people on finances, to educate them on whatever they want to actually go on to in their life. Covenant House has a back to school campaign that they're doing. Another thing where they're raising money to help support higher education for the youth that they're serving. There's always an opportunity to engage and to support the efforts that are going on currently, but always look for it in the most strategic way. So if you're going to give money just outright to a funder, to an agency to make a thing happen, check back with them and actually do a deep dive into what the impact of that, what your funds did, because you're responsible for that as well. So being responsible for the change that we see, find innovative people who need that upfront cost covered. There's a lot of opportunities that I've seen recently. There's some nonprofits that sell different things. And whenever you buy from their website, a portion of that goes back to their agency. So I buy candles all the time from a nonprofit that I'm familiar with, just so I can put a little bit toward it. I just bought my mom a candle last week. So doing stuff like that, I feel, and it made me feel good. That night I slept really good because I felt good about the thing that I did. And then there was another one that had an Amazon wish list. I went on the Amazon wish list. They were looking for podcast material because they're doing podcasts now because of COVID-19. I bought them a camera and some tape, and that was shipped over to their organization. And I think it was in Texas or whatever. So those are really good opportunities to support a nonprofit in a really small way that makes a huge impact.
I would just add a few small points, and those were amazing comments, Milan and Gabe. I would say to funders, fund more. So yeah, you all have access to other types of funding, and now is the time to do that. I mean, this is a pandemic, it's an economic crisis, it's a racial uprising. So it's a unique time in history, and I think we all have to step up to that time. So that also includes funders. That's the first point, I think. The second one is to fund Black and POC-led orgs. So fund the orgs that are community-based, like Gabe's, and youth like Mr. Randolph. And the third one is fund solutions that put power in the hands of young people. Because as Milan said, providers may lie. And how do you trust that your funding was used properly? So if a provider can show how those funds are actually either giving money to a youth or giving them power and agency over their own lives and power and agency over the nonprofit itself, there's a bit of a fail-safe because the youth is not, or the young person is not as dependent. So I think that's really critical. So at Point Source Youth, we're seeing things like rapid rehousing, where you get their own leases and their own names. So now they're outside of the nonprofit system. Of course, they need money from that nonprofit to pay rent that comes from HUD, but it's their own place from the very beginning, and things like cash transfers, and if you choose things like host homes. But we're seeing as the dynamic keeps shifting, the old way of doing things, of having youth go to one building and get support from one place that they're dependent on, doesn't really work.
Can you talk a little bit more, Milan and Gabe and Larry, about how young people are managing right now in some ways? Like, what are the bright spots? Let it be peer-to-peer, let it be, I've heard some incredible stories about sharing Wi-Fi access among networks of young people living with, like, just really important solves that can help inspire folks out there right now to be more realistic and innovative and honest, I hear, about their services. So what do you think of, Milan and Gabe?
I mean, I have one. I'm not Milan or Gabe. I have one super short story. So we did a call with a funder, with like a major super bank, not funder, a nonprofit. And the nonprofit mentioned on the call with this bank, the bank asked, what do you miss the most, or what's been so hardest during COVID? And the nonprofit said, well, it's been really hard because we're not in our office and we can't serve our youth, and we can't give them like hugs. And then separately, Milan did a webinar for us, and on the webinar, folks asked, like, this is so hard, like, what's happening? And the youth on the webinar was like, we're ordering drinks from drag queens, like, we got this, we're resilient. It's like, on the one hand, you have the nonprofit, like EDDs, who are sad they can't hug youth, and youth saying, like, we got this on our own. So I think that just really shows, right? If we like trust youth and put power and money in the hands of youth, we're going to solve a lot of problems. And instead of that, a lot of resources and thinking goes to the nonprofits versus the youth themselves. I don't know. That was the first story that came to my mind. Milan, you were on that webinar, remember?
Yes, I remember. So I feel like exactly that. So people don't, and it's weird because it's like a double-edged thing. So I don't mean it in its most severe sense, but people don't need to be told what they need. And I feel like in everyone's individual life, like you have to learn how to, figure out one's finances and what you want to do, what you need to have done, and how to focus and figure out how to make all of that work for you in your individual life. So I really feel like, yeah, every time that there's an opportunity to convene and to work together and to kind of troubleshoot some of the experiences and concerns that we've had, like just even this discussion here is really good for my mental health. Like I feel really great after I have discussions like this, because it's always an opportunity to learn and to grow from one another. So taking opportunities like this, I've been noticing again, like since Zoom has a free option for 40 minutes on Zoom, where people are starting up their own Zoom calls and their own groups, and just starting to get a new level of normal into what our world is going to look like now post-COVID or during COVID. So I think that, just like Larry was saying, like those have been some successes that I've seen.
Yeah, same. I mean, I'm so proud of my generation, and I'm even more proud of the generation that is just behind me, because the level of innovation and brilliance around entrepreneurship that I am seeing is just, it's so inspiring. And, I think what has awakened in so many young people's mind, because I'm a big nerd on democracy. That was my field of subject in undergrad, and I love the study of democracy. And what we're finding in a democratic system is that we are growing and growing with income inequality in this country. And young people are in particular are at the short end of that stick. And this is going to be the first time that 2/3 of the youth are going to be poorer than their parents. And that is a very, that's a fatalistic revelation for young people why would I try? Why am I trying then? And so I think that entrepreneurship has really, been given an attention as a vehicle for moving past some of our economic circumstances. And so, I'm seeing that. And I think that what funders can do to play a role in that is, we all know on this call, and the funders, know as well, that, entrepreneurship is still a business, and there's real mechanics to taking your idea and your innovation and making it something that's economically productive. That's a different thing than just having an idea. So if funders are able to invest in more leadership development programs and, more entrepreneurial investment programs and integrating workforce into each of your priorities, there could be a workforce underpinning inside of each of your priorities, and ways that we could put back into youth innovation and actually fund youth innovation and fund these solutions and ideas through investment. I think that is a really great way that you all can play a role in sort of the resiliency of young people right now.
I appreciate that encouragement. And I think that one of the things that's happening right now for young people too, I think, is creating businesses in one places, but also spaces that can then be sustained through their members and through their people and through those connections. And I think for, folks who are concerned about LGBTQ young people, those spaces are the most important sort of access points for safety and care and healthcare. And so the more the merrier, really, in terms of those networks of peer support and those safe spaces, but trying to figure out how to invest in those in a way that puts power into young people's hands, and to do what we can to seize this moment of maybe relaxed or evolved required infrastructure and processes that have often gotten in the way of young people. So I appreciate that encouragement. We're almost at a point in time for questions. So I just want to open it up to our chat here, and then open it up to you all as panelists also, if you have any questions for each other as we close out this discussion, or things that you didn't have a chance to talk about before that you think are important pieces of the puzzle right now.
And Amelia, I just want to let you remind everybody, if you would like to ask a question, I think there's an option to raise your hand. You can also use the chat function or the Q&A, and we're happy to bring up your questions for our amazing panelists. And I'm sure, because we can't see all of their cameras, there are a lot of snapping and clapping going on. And I know I've been getting some text. So just want to encourage everybody to interact with this great panel if you have a chance. But we're quiet at the moment, so I would encourage maybe you could start with the panelists on questions, and then I'll keep you updated if things come in.
Go ahead, Larry. Do you have a question that you wanted to pose to your panelists before we close up?
Yeah, I mean, I think so Gabe, I mean, in the beginning when California had this stay-at-home order, and then you rose up in your community to house youth. So thank you for being incredible. And you found that some of the hotels were not available, and you got a waiver for cash. Can you just walk folks through that kind of moment in innovation? Because I think that's an example of how we could seize this time to put power in the hands of youth.
Yeah, so in the early onset of COVID-19, the primary modality for housing in the state of California was through Project Room Key, and that initiative used hotels, motels, and existing structures to house the homeless population. We focused on housing those living with HIV, youth, and vulnerable seniors. That was our priority populations. And we found that there were a lot of unfortunate circumstances with employment in which people weren't necessarily houseless, they had housing instability, and they were at the door of being houseless. And I think that that was an opportunity for us to recognize that actually the cost of the cash transfer value that was needed to bridge the shortage of rent was actually significantly less, sometimes 50% less than the voucher rates for the hotel vouchers. So to give perspective, it's about $92 after taxes per day, which is the standard county rate that typically all of us emergency housing providers pay to third-party commercial hotels and motels. It comes out to about $2,760 per month. I live in a really nice studio. Now, she's a studio, okay, granted, but it's a really nice studio, right? It's a really nice studio, and I don't pay that much in rent. And so the idea that I am paying for certainly not my studio in these available hotels and motels that are allowed for us to be contracted with by the county, for us to be paying well over what the average monthly market value rate is for a really nice apartment, not even just a really nice apartment, was just obscene to me. Like that just, my MBA and my math kicked in, and that just didn't make mathematical sense to me. And felt like undergrad school test again. Like, what? Go with the more cheaper, most cost-effective solution. And so our largest cash transfer that we provided was $800. That was the largest. And many clients didn't even need that, right? They just needed the cash to be able to determine their own destinies, and often found more cost-effective solutions than the ones government was offering. And so, I think that was a really big example. I do wish that federal funding at HUD could be allowed to do that, and that we could get, that could be allowed for all HUD type funding. But that's something that we were able to do with some of our existing funding in the beginning of COVID.
Amazing. So we are working behind the scenes with HUD for that, Gabe. So stay tuned. And Milan, were you going to say something? Sorry.
I just wanted to speak to the cost effectiveness. But yeah, a lot of the methods that we go about to house and to serve people are actually really not cost effective at all. And if we actually took the time to really focus in on where the actual problems are, and again, looking back at this social determinants of health, what are the things and the factors that put people in the conditions that they're in? If you put them in a community that is subpar living conditions and make it super hard to get any access to any other services, it's people just need to live their life. It's a weird concept that it seems that we have around the conservatism around taxing and serving people who are underfortunate or misfortunate. And it's the same services that a person who had the support that our communities don't have would have naturally. So like mental health services or support services, stuff like that. It's because like you would just have a family that would have supported you through those things. Like if you weren't homeless because you were sleeping in your room in your mom's house, like because you had a family, you had someone to support you. Like literally no one gets through this life by themselves. And that is the place that we're actually serving for. We're being that somebody else to support someone because they have nobody else. So keeping that in mind, that we should be doing the most cost effective. We should be doing things that are actually educating and promoting them to make better decisions for their life that will be progressive in the long term. I've noticed I'm building myself individually around like finance and my career and all these different things. And these are things that I'm having to do by myself, or things that I got while I was in college, or things that I got when I was growing up at home. So these are things that, imagine someone who was precariously housed since they were 10. So they don't have all the same things that a person would naturally have, and they wouldn't have the support that a person would naturally have if they grew up in a loving, caring, connected family. So these are the types of things that I think about, is that when I find myself in places where I am in need of assistance, those have been the most times that I've been disrespected, actually. I've been actually treated the worst when I've needed help, whether at the DFACS office for food stamps or at the shelter when I asked for a specific type of soap because I didn't want my skin to break out when I took a shower, and I was berated for that. Like, these are the types of concerns that people are dealing with. And the more high level we start to recognize how funding can actually can actually hold these agencies accountable to ensure that they're doing the work, having the impact, and checking back with the clientele to ensure that what is the actual impact of where our funds are going, because you could actually just take it and put it somewhere else. With people who have effective programs like Larry and Gabe, like these are programs, these are people that are doing actually effective work that has been proven and shown. So
I want to say something, because we've made a couple comments. Milan's been making excellent points around holding us accountable. And I want to respond to that, because it's a role that we as providers need to do in conjunction with our funders. It's two ends. I would say that part of my job that exhausts me the most is the battle, war, titan clash that I have to do between government, private funders, and my board. When that war between the three opposing interests squeezes and suffocates innovation and impact. It suffocates it. And what ends up happening for some of my colleagues, without excuse, but it is important to identify the reason, right? Oftentimes when inflating of numbers or misrepresenting of outcomes happens, I often have found in a lot of the colleagues that I know in the private, behind the scene, ED to CEO conversations that a lot of us have, particularly agencies of color, we are often, and I see it because I get put in those positions too. We get put in positions by our funders, most often government agencies, where their expectation for what we're trying to achieve is inflated. And the practical understanding of what it truly costs per patient is misaligned. They believe for $250,000, I want to see 5,000 patients served. Well, you may not get 5,000 patients served, okay? You may get 500, but that is what is needed to actually do what you are wanting me to accomplish. And sometimes there are pressures placed that says either you strive for this that you know is unreasonable, or you don't get supported at all. And you're putting agencies in a very difficult position. And when you're in a state of survival, I'll speak for the children and I'll also speak for agencies. When we are in desperate states of survival, literally for our lives, you'll get what you get when you put us in a tight, constrained environment to fit within an institutional expectation. So that really looks like collaborative impact development, where we're working together to talk about what impact is really needed, rather than just looking at these metrics and these ones and zeros that we say equates to impact and value. So I think we also need to reformat how we look at impact so that we can encourage, stronger actors and more appropriate representation and transparency on our services and programs. So I'll just say that it's collaborative.
Definitely. I definitely think it's like setting those standards probably together, like that's in the discussion. So a lot of the grants that, and I won't speak to any particular funder, but there is a funder that I'm familiar with, a lot of other EDs and of nonprofits and like startups and whatnot, and they say they won't even like look toward funding from them because their funding is too restrictive. They ask for way too many outcomes and don't give nearly enough money. They don't consider personnel. They don't consider time spent. They don't consider travel. They don't consider, you know, paying the clientele. Like they don't consider all of the factors, but then they want to see the world change within the next 2 weeks. So I feel like that is definitely a concern that a lot of people have. So sometimes we're a little too restrictive. Like, yes, we need to have strong directive outcomes and lines of like where we want to see ourselves go and what progress we want to attain, but not with the restrictions that are in place now. Some of them are actually preventing more agencies from actually growing themselves because it's holding them back to make that one grant happen.
Yeah, and I would just add the restrictions on young people in order to get those services also, you know, that you have to have this documentation, and based on that, you only get Y service. So we've seen that a lot of benefit can happen by, you know, asking a simple question of what does a young person want, and giving them that. And that's actually not that expensive to ask that question.
Exactly, and it's much less expensive. Like, I want a place to live. Give them a place to live. Like, you don't have to make all these different assumptions of what they need and then give an extremely less cost-effective outcome by paying $100 a day for a motel room, like for a short-term outcome. Like permanent supportive housing, host homes, like these are things that have shown to be working and effective because it's more cost-effective in the long term.
I appreciate that there's such a call for flexibility right now, and that is such an important piece of the puzzle to helping organizations weather this storm and this major shift in resources and nervousness around, you know, government budgets and changes around government budgets that are happening. And at the same time, looking for those programs that can document in a way so that we're not reinventing the wheel, or putting more resources where we know they don't make the most impact. So thank you for the encouragement for funders on the line to do both and be in collaboration with grant partners as you try and figure out what impact really looks like. And I think it's important when we talk about LGBTQ young people and homeless young people that it takes a long time in some ways to get to that place where you feel satisfied that that is impact. That is the place where we needed to go together. And so for funders on the line to know that it is hard work and consistent work that wins and not quick. So we want it to be faster. So we appreciate the system hacks and the system changes that you all are pointing to. I don't know if I see any questions. Are there any questions here that we should address, Sarah, before we log off?
I just have one, you know, one of the kind of the spirit of collaboration, even in putting this call together, was to bring in funders together to end homelessness and funders for LGBTQ issues to talk about those intersections, which I think you have all done a fabulous job of doing so. But I was curious if you've had any experiences, bright spots in Amelia's words, or wins working with a funder that may have be typically siloed in their approach to any one of these issues to get them to see those intersections or to fund in a more holistic way. If any of you could speak to that, that would be helpful. I know it's a big question, but I think it might be helpful to some of the funders on the line.
Yeah, I think what we're seeing that funders are responding to innovation and they want to do more. So we had one webinar on direct cash transfers with Gabe, and the Annie EKC Foundation was on it, and then they funded a provider in Georgia to do direct cash transfers for youth in rapid rehousing. So we're seeing that funders are really excited about it, and funders concerned about AIDS. I mean, you all are doing this webinar because you're seeing that we have to talk about HIV and youth and homelessness together. And I would just say this is a very stressful but also hopeful time. I mean, the federal government is sending everyone checks, you know, that is a direct cash transfer. And in California, not for some reason, but they're agreeing to give every person experiencing homelessness a hotel room. Like, if we're doing both of those things, why can't we trust youth and give them cash to have them most efficiently and cost effectively never be homeless again? The answer to that question is we can, and with enough organizing and voting, we will. So I'm really both stressed and hopeful.
I think that's a great point around the cash transfers. I think it's interesting when we got the stimulus check, the one stimulus check earlier this year, because I was hoping on a second, but how people were always complaining about how people were using their money. It's like, oh, why are they doing this? And why are they doing that? And why? I'm like, literally, like, if it's your money, like, whatever you do with it is what you do with it, and actually can stimulate the economy or stimulate a business or grow someone's efforts and savings towards their next, like, housing or whatever goal they have individually. Like, those are just really progressive things that you can do to help support someone, because again, they don't have the support otherwise. We know people are underfunded. Like, we know that people are underpaid. Like, we've known that for decades, and we're way behind on that. The poor are only getting more poor. And if we had an opportunity and options to actually access some of the things that keep us and can actually help grow wealth. So those are always one of the things that I'm always passionate about, is helping people learn how to build wealth. So learning how to take your opportunities and take what you have in that little bit. Like, I was listening to a discussion, I think Larry was on that one too, where one of the funders was talking about a program, a provider in the Atlanta COC, about one of the programs that they had, and all of their workers were only making minimum wage, like $7.25. They're taking like $200 from them a month to pay for rent, and they were taking half of their income to put towards a savings account. It's like, oh, they're just so grateful. They're grateful for this opportunity. They're grateful for a place to live. They're grateful to have this job. And I'm like, yeah, but like, what does it look like next year when you push them out? Do they have the skills and the tools to actually live a life outside of this, when you're taking most of their money to tell them what to do with it, but actually not helping them grow with opportunities they can actually make that grow for the future? Because that's not a lifestyle long term. That's not building yourself long term. And that's what people need.
I would say, as far as a strategy and tool for getting funders to kind of see that, I am a huge supporter of the Riverside Community Health Foundation. They have been one of our largest funders. They are a local community foundation. I love having one of my largest funders be a local foundation. And the reason for that is because I get to bring my secret weapon when I need to get the funders to do something that I need them to invest in, and that's the people. And that's what I love about having a local foundation and support, because we get to actually sit down with the CEO of the foundation, with the COO, with the vice president. And I will just put you in a room with my clients, and I'm going to go to lunch. And then when I come back, you'll understand why I wrote my application the way I wrote it. And I love that. And we need to do more of that. And that's really the alignment that Milan speaks of, that providers need to have with our community. I should be able to get you a sample of representatives from each of my programs, clients, different ages, size, shapes, and colors and flavors, put them in a room and say, you talk to the funder. I'm going to go to lunch. I should be able to do that, come back, and the funder should go, I understand. And we did that at the beginning of the year when our organization was the lead agency in helping Riverside and San Bernardino County put together its 1906 application for ending of the HIV epidemic. And we hosted what was called a community caucus, first ever in the region. We gathered clients from every single HIV provider. We correlated with every single HIV provider, and they each sent a delegation, and they had special meetings with Harold Phillips, the CDC directors, Harold Phillips at HHS, and HRSA folks. Captain Mahoney was there, and they were able to sit down and just hear from the people. And I sat in the hallway and, just chilled, and I just let them talk to the clients. And when we got out, all of the federal officials says, I get it. I see why you're saying the things you say, because now the people are speaking. So if more of the national funders and the big funders that have to fund a large part of the country, if there can be some sort of approach or part of the evaluation process in the grant, and also part of the end of the year reporting, is sort of this engagement interaction with the end user, one, that would help me on the report, make me do less paperwork. Okay, if I can decrease my paperwork and we can increase the kind of representation of our impact, then you serve two things. You make it easier for me to do my job. I don't have to sweat so hard of checking off these check boxes. But then you can actually walk away assured that the person that was served with your dollars indeed had outcomes. You can hear from the client themselves. And I think we need to facilitate more ways to do that.
Thanks, Gabe. Thanks to Milan and to Larry and to FCAA and Funders for LGBTQ Issues and Funders Together for Homelessness for championing this conversation. I think folks are walking away with a sense of where there's real movement right now in the right direction for young people, and where funders can be better partners for those that are committed to young people at this intersection of LGBTQ youth and health and HIV, and keeping young people safe during a global pandemic. And so thank you for the work that you're doing. Thank you for the advocacy, and thanks for our co-hosts for this conversation this time. I hope you all take good care. Be well.
Thank you, everybody. And we will be sharing a recording.
Thank you.
And
Thank
we
you,
really
Amelia.
encourage you to share it to everybody.
Thanks, Amelia.
Thank
Thanks,
you.
Larry. Thanks, Sarah.
Milan. Thanks, Gabe. Thanks,
Bye,
Sarah.
all.
Thanks, Milan.